That is India, that is currently devastated, and it has recorded more than 300,000 new cases for the 6th consecutive day. Countries around the world are trying to help, but their efforts to send oxygen and other critical aid are unlikely to plug enough holes in India's sinking healthcare system to end its deadly catastrophe.
The emergency in India, where a worrying COVID-19 virus variant is spreading rapidly, is driving a new global surge in the pandemic. It also carries implications of countries relying on India for the AstraZeneca vaccine, millions of doses of which are manufactured there. The vast nation of 1.3 billion people recorded 320,000 new cases of COVID-19 and 2,771 deaths in the last 24 hours. Both figures represented slight declines from the previous day's record highs, but experts say this was not a sign that the outbreak was easing. Patients are suffocating in the capital, New Delhi, and other cities as hospitals' oxygen supplies have run out. Frantic relatives have appealed on social media for leads on intensive care unit beds and experimental drugs, with the government extending New Delhi's lockdown by another week. Simapuri Crematorium in East Delhi is cremating more than 100 COVID-19 victims each day since the past week, after the city witnessed a dramatic rise in the number of infections and fatalities. The endless plumes of fire and smoke has overtaken the locality as volunteers and staff work 17 hours a day to cremate dozens of COVID-19 victims, as relatives and ambulances wail outside the crematorium. The United States and Britain rushed ventilators and vaccine materials to India, while France, Germany and Canada have also pledged to support. The country has administered almost 141 million vaccine shots so far, but experts say the mass inoculation program needs to be significantly stepped up to combat the worsening outbreak.